A warm welcome to today's talk, Friday the 2nd of September. Now, when we're talking about COVID vaccines, of course, to follow all the guidelines required for broadcasting, we have to go by government guidelines. So let's look at some government guidelines now, and the first one is really quite clear. Now, this is the first one from the Green Book, Vaccination Against Disease. Joint Committee on Vaccination and Immunity advises that breastfeeding women should be offered any suitable COVID-19 vaccine. So absolutely clear advice, pregnant women should be vaccinated. That was updated on the 17th of August 2022. Now, this is from a summary of the public assessment report for COVID-19 vaccine, and this is from the Medicines and Healthcare Products Regulatory Authority. This was released on the 16th of August, the day before. Women who are breastfeeding should also not be vaccinated. So we have a government guideline there that's clearly saying that pregnant women should be vaccinated. And we have one here that appears to be saying to me that pregnant women should not be vaccinated. And we'll look at the context of this. So 16th of August, the government seems to be saying pregnant women should not be vaccinated. 17th of August update, they seem to be saying that pregnant women should be vaccinated. So what is going on here? Are there other contradictions? There are. I think there's another contradiction or two. But let's just look where this is from first of all. Now, this first information came from the Green Book here. Whole chapter about it here. And the second piece of information there came from the Medicines and Healthcare Product Regulatory Authority. So this is saying that pregnant women should be vaccinated. And this is saying, we want to get the wording right, so I'll read it. Women who are breastfeeding should also not be vaccinated. So I'm a little confused already, but let's go on. Here's the actual part of the report here that we've just alluded to, so you can check it out for yourself. It's all there, and as we say, that report was updated on the 16th of August 2022, the day before the Green Book regulations were updated. So, bit of a strange situation, really. Now, of course, on this video, we're not saying that vaccines aren't, we're not making any comment on the efficacy of vaccines. We're certainly not disparaging vaccine efficacy, and we're certainly not saying that vaccines cause any side effects that aren't recognised on official sites, government sites or WHO sites. So we're being very careful about what we're saying here. Now, summary of the public assessment report. So remember, that is this one, and that's the top of the report there. So that's exactly what we are going on. And I'm not going to be using my own words here. I'm going to be using direct cut and pastes, basically, from the report. So this is authorisation for temporary supply COVID-19 vaccine. This one's about the Pfizer vaccine. Concentrated solution for injection. Department of Health and Social Care. About Pfizer limited BioNTech vaccine. Updating, as we said, on the 16th of August. Now, reproductive and development toxicity, fertility and early embryo development and embryofoetal development. And of course, in America, you don't spell fetus with the O. So that's the title. A combined fertility and development study, including teratogenicity and postnatal investigations in rats, is ongoing. Now, teratogenicity means anything that causes abnormal fetal development. So, for example, thalidomide is a teratogen, alcohol can be a teratogen, sodium valproate can be a teratogen, radiation can be a teratogen. So that's what they're investigating. Now, this study is ongoing. That indicates to me that the results are not yet published. So that is ongoing. And they mention a few other things in this report here. Prenatal and postnatal development, including maternal function. No such studies have been done. So no such studies have been done. And remember, this is the report that was updated on the 16th of August 2022. Studies in which offspring juvenile animals are dosed and or further evaluated. This is animal toxicology, of course. Oh, no such studies have been done. All from this website. Local tolerance, no such studies have been done. The assessment made as part of the general toxicity study should suffice for, and a separate study is not needed. So it may well be that these aren't needed. Okay, we'll We'll accept what they're saying there. Other toxicology studies, no such studies have been done. So looks like the animal toxicology is not really in place from that. And I'm not boring with this for no reason, that this is coming to a good point. Just stick with it. Now, this is the toxicology conclusions, toxicity conclusions. There is the absence of reproductive toxicity data is a reflection of the speed of development to first identify and select COVID vaccines. So they're saying that because this was done quickly, there's an absence of toxicology data. And it's rapid development to meet the ongoing urgent health need. Now, yes, there was an urgent health need. Is there an urgent health need now? I will not comment. I'll let you decide if there is or not. In principle, a decision on licensing a vaccine could be taken in these circumstances without data from reproductive animal studies. So this is their kind of rationale for why they were allowed to do that. And actually, this is based on, I don't think we'll have time today, but this is actually based on this report here, Regulation 174, Information for UK Healthcare Professionals. So it's to do with Regulation 174 of the licensing arrangements. But there are studies ongoing and these will be provided when available. So good to know that studies are ongoing. Can't quite remember how long we've been giving vaccines for now, but it's a while. But good to know the results will be provided when available. They'll be provided when available. Now, this next bit here is particularly interesting. In the context of supply under Regulation 174, which is the emergency regulation, right, it is considered that sufficient reassurance of safe use of the vaccine in pregnant women cannot be provided at the present time. So they cannot provide sufficient reassurance of safe use of the vaccine in pregnant women at this current time. So, interesting. So you can start to see where they're getting this from now, this statement here. Women who are breastfeeding should not be vaccinated from the 16th of August. Direct quote. This is not me saying this. Please don't think this is me saying this. These are cut and pasted from the site. However, use in women of childbearing potential could be supported. Now, who's a woman of childbearing potential? Well, you don't need me to teach you that, obviously. In women of childbearing potential could be supported. So vaccines could be used in women of childbearing age, provided healthcare professionals are advised to rule out known or suspected pregnancy prior to vaccination. Now, of course, healthcare professionals should be able to do this. We have ways of testing for pregnancy. We can do human chorionic gonadotrophin urine analysis. We can talk to our patients and we can do physical examinations. So this seems to be saying to me, help me here, this seems to be saying to me, if the healthcare professional is satisfied that the person isn't pregnant, they can go on and vaccinate. But it is considered that sufficient reassurance of the safe use of vaccine in pregnant women cannot be provided at the present time. Hence their advice not to vaccinate in pregnancy. And that is it there, as updated on the 16th of August. So I'm making no comment on this at all. I'm merely reporting what the government sites say. And then it goes on to say, women who are breastfeeding also should not be vaccinated. So this seems to me to be saying, this report seems to me to be saying that pregnant women, it is considered, well, basically it's saying pregnant women shouldn't be vaccinated and breastfeeding women shouldn't be vaccinated either. Okay, that's what that's saying to me. If you think I've misinterpreted those words, do let me know. Now, if we look at the Green Book, so this is the Green Book. Now, in clinical practice, the Green Book is your absolutely definitive text. It's your Bible. You go by what's in the Green Book. So if you're umming and ahhing about a vaccine, and I've given vaccines over decades and taught hundreds of people IM and VAC procedures, and you go by the Green Book. What does the Green Book say? So the Green Book is pretty clear. There's no known risk associated with giving inactivated recombinant viral or bacterial vaccines or toxoids during pregnancy while breastfeeding. The reference there is Kroger et al. 2013. Seriously? A reference from 2013? Seriously? Anyway, that's what it says. A development and reproductive testing of the Pfizer, BioNTech, Moderna, AstraZeneca vaccines in animals have not raised any concerns. But we did notice that quite a few of the studies had not been done. So given that they haven't been done, I suppose it's not quite so surprising that they haven't raised concerns. JCVI has therefore advised that women who are pregnant should be recommended to receive primary immunisation. And the pregnancy, in fact, they go further. Pregnancy is considered a clinical risk group for autumn booster programme, indicating they should get priority, I would have thought that means. So that's what the Green Book says, but the report says women who are breastfeeding should not be vaccinated, and this other one is saying that pregnancy should be excluded. Pregnancy should be excluded prior to vaccination. Now, I'm getting a bit of a tension between these two statements personally. If you understand it, explain it all to me. I've maybe misunderstood, as I can do from time to time. Routine question about LMP, last menstrual period or pregnancy testing, is not required before offering the vaccine. This is still from the Green Book, so they're not worried about that from that statement. Surveillance of the inadvertent administration of COVID vaccine in early pregnancy is being conducted for the UK by the UK Health Security Agency. Immunisation of Vaccine Preventable Disease Division, to whom such cases should be reported. So it's saying it seems to be fine to carry on giving vaccines in pregnancy, but if it turns out you've given it inadvertently in pregnancy, you should report that because they are studying this. Again, doesn't really quite add up to me. So the Health Security Agency, Immunisation of Vaccine Preventable Disease Division seem to be surveilling this. This surveillance has been undertaken to document safety in women who unknowingly receive a vaccine in early pregnancy. Now, if the woman knows she's pregnant or doesn't know she's pregnant, I don't really see that makes a difference to the way the vaccine would work. I suppose there could be some sort of placebo effect. Anyway, Green Book, there is no known risk associated with the... There is no known risk associated with being given a live vaccine while breastfeeding. So that says there's no known risk to give the vaccine while breastfeeding. But this report says women who are breastfeeding also should not be vaccinated. There you go. I see clear contradictions there. So quite what is the position is unclear from those different reports. Now, there's other things I could go on and show you, but they're the main contradictions I wanted to... No, paradoxes, apparent contradictions I wanted to point out between the practical advice to healthcare professionals given in the Green Book and between this summary of the public assessment report for COVID-19 vaccine related to Pfizer, BioNTech, the Medicines and Healthcare Products Regulatory Agency. I will be looking in the comments. If I've completely misunderstood something, do please let me know. As I say, I'm stressing, I'm not saying the vaccines are good, I'm not saying they're bad, I'm not saying that there's any side effects that would contradict regulations. I'm just pointing out, all through direct quotes from direct government sites, something I don't understand. So thank you for helping if you can, and thank you for watching.